Hello, everyone. Welcome. Thanks for joining us in this episode. Sean Brewster and Bodine Ledden here today. Bo, today we are talking about something that is very important for anyone in business, but also anyone who's just trying to build their patient list, which is word of mouth referrals. Would have to be the thing that everybody wants when it comes to new business, new clients, new patients coming through the door. Obviously, we can market to people, but when somebody recommends us and they come to us with that strong referral from a friend or colleague or family member, it's so much more valuable, isn't it?
Yeah, it's probably the most trusted source of marketing. So if you can do this well, then you'll save a lot of time, but it can really pay off in the long run.
Absolutely. And we all love that word of mouth referral from someone. Like when we're looking for a health practitioner, we're looking for someone to go and see for assistance with a problem that we might have. We want someone to say to us, "Hey, go and see this girl, that guy down the road. They helped me with that very thing." And it's like it gives you some confidence ahead of time before you even get in the door that they're going to help you or they're going to be able to help you, which is sort of half the problem solved when you've got that um, positive idea in your mind that this is going to be a good experience. You walk in there, then they have the knowledge and the skills that you're hoping, and then it's basically a job done a lot of the time.
Yeah, definitely. And I always remember this from an old colleague of mine, Brad Hiskins, who would say, "You never know who your rainmaker will be," and that sort of always stuck with me. Treat every patient, every person like they're your rainmaker that's going to bring in a lot of business. And so I guess thinking of it that way, putting 100% into every single patient, because they could be that person that goes and sings your praises to so many other people, and then that's just this constant stream of business for you. So yeah, I think that's a good way to think about it.
Yeah, that's right. And I also like the idea of this as a topic for discussion today because often people who are looking at ways to get busy in their clinical practice will look at ways to get repeat business, the same clients through the door, that rotating, stream of patients, the same ones coming through each week, each month, whatever it might be, which I personally, and I think you too, aren't a great fan of. We much rather, for our own sanity and our own interest, to be able to treat a wide variety of people over extended period of time. It's much more interesting as a clinician, but it also means that you're getting results for people. You're helping people achieve the outcomes they want. If they're having to come back to you on a regular basis for extended periods of time, maybe that's not the best solution for them. And so the word of mouth referral as a way of building a business is great because it means that you're getting new people all the time. And then when people need your services, they can come back if they've got a new issue, a new solution that they need help with. So I think this is a good way to kind of frame up building a business as well.
Yeah, absolutely. In fact, last week I had two patients together, and sorry, coming in after each other. And I said, "Oh, do you know them?" Because they were connected through this person, and that particular patient said, "Oh, they're sending you all of their friends and family," and that's exactly how it happens. One person tells another person, and then they'll keep singing those praises, and then before you know it, you're seeing their brother, their uncle, their coach, their it's just it sort of just continues to roll on from there.
Yeah, that's right. I always used to tell this story about this concept of I had a patient years ago who was their family owned a chain of car yards, and they were a pretty well connected family in the area that I was practicing in, and they knew everybody. So I treated the daughter, and she got her mum and her dad to come in, and she got her brother and her sister-in-law to come in, and her husband came in, and then she started referring out to family and friends and all the clients that would come in through their car dealership. And pretty soon it was half my client list was through this one person. So they're definitely my rainmaker. But the story went on to years later. I ended up buying a car from them. And I joked and said to them, I think you've probably paid for this car through all the referrals you've sent me and the car as well. So I think this is probably the best business exchange I've ever had. So it's amazing how things multiply out over time.
Yeah, 100%. And I think that's the important thing when we talk about word of mouth. You've got to really make yourself known. You've got to tell people what you're doing, what you're good at, and
Yeah.
demonstrate that you've got the knowledge. Because, that sort of once people know who you are and what you do, I mean, you use that as an opportunity, because again, you never know who that rainmaker will be that you're speaking to.
Yeah.
But if you've got a particular interest in an area, talking to other people about that interest, and people that speak to a lot of other people, could be your barber, it could be personal trainer. Um, you know, these are the types of people that will spread the word to a lot of other people. Classic at a CrossFit gym, right? They're usually a pretty tight knit bunch. You get in with one of them, you do a really good job, and you demonstrate knowledge. You demonstrate skill and expertise. Well, the next person's going to come in, say, "Oh, you've got back pain. I had back pain, and I went and saw this guy." So that's a nice way to start that word of mouth.
Absolutely. In fact, that's one of the concepts I wanted to touch on as well, which is, demonstrating that competence in something. I think you could probably even go one layer more than that and say that when you have that conversation with a patient, let's just say it's a CrossFitter, for example, comes in and you're a CrossFitter, as an example. You could say, thanks so much for coming in. I love working with CrossFitters. It's a sport, it's an activity that I really understand, I feel passionate about. And it's a real joy. I actually enjoy working with athletes like yourself. And so thanks for coming in. I know this presentation quite well. I've seen it plenty of times. I've gotten great results. Having that conversation with them about what you like to do, what you're passionate about, the things that you enjoy, and connecting the dots between you and that patient builds rapport no end. And it also builds a lot of confidence from their side, that you actually don't just understand the presentation, but you understand the psychology and the situation that they're in. And so I think absolutely demonstrate competence, but also demonstrate interest and care, and even fascination in the thing that they're presenting with, because it'll just have them have so much more buy-in for you as the practitioner, the expert, the person that they want to send their family and friends to say, go and see Bo. He knows this stuff really well, and he actually likes treating it. And who doesn't want to go and see somebody that they like hanging out with? So this is, I think, an important thing, is to demonstrate that competence and actually show real interest if it is something that you're genuinely interested in.
100%. Yeah. And if you don't know the sport, there's going to be less trust from the practitioner, from the patient as well. So, finding your interest and demonstrating the competence and knowledge and understanding, from not only a practitioner point of view, but from someone who has participated in that sport before, or is genuinely interested in it. You can talk the same sort of language, and so that's important. But like you said, show them that you're interested. I guess show them that you're also really interested in how they're responding to that treatment or to their exercise intervention with your follow-ups. So, if let's go back to CrossFit, if they're going for a workout the following day, hey, let me know how you respond after this session. Let me know how that knee or the ankle is going. So send me a message as soon as you finished, or the following day. And that way you've used that as an opportunity to see, well, was that load too much? Does that need regressing, or can they continue on or progress that load or intensity from there? And so using that to just say, look, I really want to know how you responded. And then we can modify. Sometimes it can be a little bit sensitive after that training. We might need to space that out, or put a rest day in, or modify the amount of load or intensity. So we're going to work together on this. And I guess that shows them that, wow, like they're actually interested in me getting better or improving or getting back to things that I enjoy doing. So I think that level of interest, is really good, but it also builds your knowledge and understanding as a practitioner to see how these injuries or these pain presentations will typically respond, in different populations.
Definitely. And in real time as well. And like you say, what an extra bonus level of care that you're showing, that you want to get that feedback immediately. And more often than not, we have to wait until our next follow-up appointment a week later, or whatever, imaginary time period that might be, to check in with the person and sort of say, oh, how did you go? Oh, I think it was a bit sore. And starts to become quite vague. And so to be able to give that real-time immediate feedback, particularly with athletes, particularly people who are very invested in their performance and how they feel when they're moving and doing things. That can show another layer of interest and real care for the patient that they wouldn't necessarily get elsewhere. And how long does it take to you to, receive that text message and reply quickly? Fantastic. Sounds like we're on the right track. Keep going. Or let's halve that, or let's double that, or whatever we might need to do. It takes 2 seconds, and it's and I think there's a move away from being overly available from our patients when it comes to that sort of thing. But the other side of that is, if you can do it, what are the benefits from that? I think that's amazing, being able to have that speed of reply and that extra level of interest. If you can afford the time and space to be able to do that for your patients, even if it's not all of them, try it. I think it's worth it. I think it's a really valuable thing. So great advice. Yeah.
Yeah, exactly. And like, sometimes we don't need to see our patient all the time. For example, I've got managing a patient with a calf tear at the moment. I don't need to see her all the time. I've educated about how this is going to typically behave over the next 4 weeks, and what that's going to look like as far as exercise and load progression and any modification advice. And so I'll check in and say, all right, how's that going? Let me know how this is responding, because we might need to increase your load. And we can do that over a message without having to come in for a consultation. And yeah, that might not be the most financially beneficial thing for us to do as practitioners, but at the end of the day, this is a person that will also tell everyone else, and in fact already refers everyone to me. And so you look at it through that lens, is all as we need is that little bit of advice to say, okay, let's load that up a little bit more. Let's get you back to doing some jogs this week, or some slight change of direction, or start to integrate some plyometrics. Like, that doesn't need a face-to-face consultation. That can be done simply over a call or a text message. But again, that's a lot of value for them. So I think that's important when we even consider how much we're charging people, that it may not be that you're just charging for that consultation. It can be the follow-up advice that you're providing, the fact that you're always contactable and available, you're willing to give additional advice, progressions, regressions. And so you factor that into your price. And when you think, oh, you're a little bit more expensive than other people, but what you get is me. You get ongoing advice, you get ongoing support, someone that actually cares about your progression. So yeah, it obviously can take in a little bit of extra time. And if you've got a full book, if you're treating 40, 50 patients a week, well, that can be a lot. But I guess if you making it known that you are available and contactable, and you can provide that additional advice, I think that's really, really valuable.
Yeah, that's right. And demonstrating value, over time, the question about what you charge and what your fees are becomes irrelevant pretty quickly when people start to see that value. And I think that's probably a great topic for another episode, is to talk about pricing and demonstrating that value. You could go the other way too. You could say, hey, I probably don't need to see you next week, or whatever the period of time is. What we probably should do, though, is to have a quick check-in to see how you're progressing, and then I can give you some advice. That's typically going to take 15 minutes. Why don't we set up a Zoom call for 15 minutes? And rather than charge you for a whole consult, I'm just going to charge you this smaller amount to make it better for your time and more cost effective. And then in that hour, you might have 4 of those catch-ups with patients. And from a financial point of view, you could end up making more than, a single consult that might take an hour otherwise. So there's different models. Absolutely. You can charge more and be available, ongoing, or you can charge smaller amounts for shorter consultations and provide the advice that you would have had to wait for another consultation time to do. So there's all these options available to us. And I think the smarter we get at tailoring the service to the patient's needs in a model of care that suits them and works for them, the more valuable it is for them. And then the happy they are to pay for that, and even happy they are to send all of their athlete friends, their family, their colleagues, whoever from work, to come and see you, because they go, this guy, this girl understands me. They know what works for me. They've tailored this thing to me. And it's not just patient-centered care, it's patient-centered service. Like, this is the whole package now. We're putting it all together for them.
Yeah, exactly. And we speak about this a bit as well. Like, understanding the patient's expectations, what are you actually here for, and what would you like to get from me? Because um, you know, I guess sometimes the expectations of what the patient wants to what we think that they want might not align. And so understanding that from the start is really important, because sometimes if a patient comes in and they're here because they want to get back to the things that they enjoy doing in the shortest time frame, well, that may not require a session of just manual therapy, whereas some patients may come in and they just want a full session of manual therapy. And so it's really going to come back to, as you said, tailoring that very specifically to what they want to get the most benefit in the shortest period of time. And so I think from initially setting that up from your initial consultation, spending quite a bit of time on the assessment. Again, this comes back to those expectations. If someone comes in and we understand their expectations, they want a management plan. They want something that they can do themselves, to sort of reduce their pain, get them back to those functional activities and meaningful activities. And so I think really spending a lot of time in your initial consultation, providing a very thorough assessment, educating them about what you think is going on, how long you think that it will take, what's going to be some barriers or inhibition to progression, and how you see that playing out. But providing that very thorough consultation will give the patient a lot of confidence in saying, oh, they were so thorough in that. And that's an opportunity for them to tell that to other people, that, oh, they were really thorough. They really tried to understand what was going on. So that plays into the word of mouth. And that, I guess, that loops back around to, never knowing who that rainmaker is, because if you can really be thorough, really demonstrate your expertise, professionalism, understanding their story, providing a really, I guess, setting up a good treatment plan going forward, and then a self-management plan, that gives them things that they can do, and they go, wow, that was a really good consultation there. Far more likely to refer that on than just, all right, jump on the table, let's press on this, because anyone can do that, really.
Yeah.
So, yeah, provide a thorough consult.
Yeah, perfect. And that plays into my next point too, which is, demonstrate competence through clarity. The exact same kind of concept, and taking it further and sort of saying that, not just explaining the treatment plan and assessing what you're finding, but actually going into, okay, you're presenting with this issue, whatever pathology, whatever injury it might be, and asking the questions, how much do you understand about that, or what are your beliefs or understanding around that presentation? And first of all, starting with what they think they know, because often that can be wrong, or it can be colored in incorrectly. That's probably another way to put it. And then maybe correcting those colors and correcting the explanations for them. So actually, that part of it's true, but over here, there's a bit more to this than you might not be aware of. And explaining to them the pathology, the presentation, the reason that they're experiencing pain, and so that they can have this really in-depth understanding of it. And I think adopting the hat of the teacher, it's not just doctor knows best. Sometimes the teacher is the best solution for the problem, because they can provide understanding. When the patient gets that understanding, they're now a participant. They're now a part of this process. So I think that's something I've come to realize in the latter part of my clinical career, which is like, I'm just going to stop and sit and be still, ask a lot of questions, understand what you know at this point, and then I'm going to go through a process of education for you. Before we get on the table, before I touch you, I want you to feel like you know as much about this thing as you possibly can. And then I'm going to explain how I think I can help you. And then we'll do our assessment and our treatment and figure out what we can do for you next, and what you'll do as part of that story as well. And so over-explain, I think it'll feel like you're over-explaining things initially. But my experience with that is that patients appreciate that more than you realize, more than you expect. And on the other side of it, they walk out going, oh, that's great. Like, no one took the time to explain that to me before, because I think a lot of health practitioners assume the patients just want the solution. They don't want the understanding, but it's often very difficult to get to the solution without the understanding, because they'll go away and make poor decisions about activity, about load, about sleep, about diet, about all the things that might affect their presentation, because they won't understand it. And so taking the time to what feels like over-explain, walk them through it, create opportunities for questions and answers all the way through. And then at the end say, okay, now, is there any part of that that is confusing at all or that you don't understand? I'm happy to spend more time and discuss this with you. And they'll be like, wow, that's great. I didn't expect any of that. Thanks so much. Now, what do I do? Cool. Okay, now here's what you do. And then you take them on the assessment and treatment journey from there. It is a huge paradigm shift, I think, for a lot of manual therapists to go from patient comes in the door, figure out what's going on as quickly as possible, get them on the table, do the thing to them, receive money, send them away. Like that's the mindset of so many people. And there's a time and a space for that, of course. But I think if you're really looking for solution-based interventions for patients, like getting them towards a solution, a better outcome than they walked in with, it requires education. And Bo, you and I know that like we love learning, we love understanding things and pulling it apart and figuring out how it works. If you didn't have the ability to ask questions, if I didn't have the ability to ask questions as a patient, I would feel like I wasn't getting a good service. Now, why don't we then assume that for our patients as well? I think it's really important to give them an opportunity to get that understanding before you even begin the treatment. And then after the treatment, reiterate that, reinforce what you've said, and then say, now that we've done this and you've experienced this and now you're feeling this, do you have any other questions? Do you understand why we're going in this direction? And so it's question, answer, question, answer, question, answer, question, answer constantly until you are both standing side by side, not one leading the other, and then you can move forward together.
Yeah, exactly. And like exactly what you said, if we understand what they think is going on. For example, I had a patient recently with lateral elbow pain, ongoing for about 8 months, quite frustrated, sort of really deflated, thinking that that this is just not going to get better. And I said, well, do you know what? Do you know how long these things typically take? And then educating her that, look, this can take between 12 months to 2 years in your typical prognosis. There are things that we can do to modify that. Do you know what the underlying pathology is, the driver behind this? And questioning that, and then saying, well, actually, yeah, there might be some degenerative changes. There might be a partial thickness, undersurface tear, as you've suggested. But believe it or not, these things respond really well to load. And although you've been doing some exercise, the exercise load is probably not quite adequate because it's far too low to generate some adaptive changes. And so by educating them about what it is, how long it will take, and how it will respond to the proposed intervention, that is important, because then they go, oh, okay, that makes a lot more sense. I wasn't doing that before. And so it gives them a bit more confidence in moving forward. It gives them more trust in you, and there's more buy-in as far as being consistent with the proposed intervention. And you're looking at the different contributors that may play into that and seeing how you can address those different contributors. And so at the end, this particular patient just wanted a plan. They wanted some management, but also some hope that it was going to get better. And so by going through that in a really thorough process and giving them a self-management program, that in itself is enough to hopefully get better results for them, but also that can sort of increase the word of mouth referral as well.
And I think that tying that connection back to the why, not just the what, is super important for, I know we're not talking about patient compliance here, but if you get very compliant patients, that will improve word of mouth referrals too, because they understand why they're doing what they're doing. So, when you give someone some exercises to do, I want you to do these calf raises, I want you to do this lateral raise, I want you to do this whatever. And they go, oh, okay, he's giving me exercises just like they all do. And off they go. Versus, okay, to really get a solution for your shoulder problem here, we need to improve the health of the tendon. One of the things that will improve the health of the tendon is consistent loading, appropriate loading over a consistent period of time. And so you're going to do these exercises. Here's what they will achieve for you, and here's roughly how long it will take. You probably shouldn't expect to feel any different for about this long. But if you do it consistently, we start to see results over time. Not only will it reduce your pain, it'll actually improve the robustness of the tissue, so you're less likely to get the injury again. How does that sound? And they go, right, now I've got the why, not just the what. Versus, okay, as part of your rehabilitation, you need to do these exercises 3 times a day for until I say stop. There's no buy-in for that. There's no understanding. It's just an instruction. And us as adults don't like getting instructions. We like understanding things. And then we're happy to participate most of the time when we understand the reasoning for it. So I think this is a really important thing, not just for compliance, not just for buy-in, but for, like you said, word of mouth, because it helps people understand why they're doing what they're doing. And when you have that understanding, like I said before, you're a participant. Now I'm happy to participate in this thing because I'm on board. And it sounds like you know what you're talking about. So I'm going to send you my sister and my uncle and my whoever, you know. And this is how I think this is how really good quality businesses are built. It's not built on the same 50 people booking in week after week. It's 50 people who tell 50 people, and then those 50 people tell another 50, and pretty soon your client list is 400,000 people that know who you are, you know, and it multiplies out from there. So yeah, great advice, really good. But do you have anything else?
Yeah, no, that I mean that pretty much sums it up. But it's obviously it's a layered approach. Like it really comes back to a good, robust overall management, as opposed to, hey, please send me all your friends and family, tell everyone about me, um, because it's sort of, if we go through those different layers and really provide a high quality service, a lot of information, go above and beyond their expectations of value. I think that's what's really going to as you always say, create that slow burn, and this will sort of catch on to many different people over time and really build your client base.
It's a Yeah, there's a push or a pull approach, isn't there? You can push your business at people, say, here's my thing, here's what I do, come buy it, come buy it. Or you can create a pull approach, which is let me show you what I can do. Let me demonstrate some value. And then that will attract. You know, it's you're pushing it out or you're pulling them in. And it's a very different experience for the receiver of that to be like getting smacked in the face by advertising and asks and like requests from you all the time versus, hey, these guys, this girl actually know what they're doing. I'm more than happy to come and see them. I'm more than happy to refer my family and friends because I trust them. And it's just all about trust. Build rapport, build trust, build authority through that. And then, you know, the business takes care of itself.
Yeah, I guess just one more point. Like it's sort of the example of someone just comes up and hands you a business card and you go, yeah, cool. Yeah, I'll definitely check you out.
Yeah,
Goes in the bin because
absolutely.
there isn't that trust there, or the reason or the value. It's sort of someone is pushing that in your face. Um, Versus if you demonstrated that value, provided, I guess, reasoning, told people what you do, what you're good at, all of that sort of stuff, then they're probably more likely to say, "Hey, do you have a business card that I could get off you?" Yeah, so like you said, push or pull.
Yeah, no, great example. Perfect. But hopefully that's helped a few people maybe reframe how they're thinking about trying to get more of that word of mouth referral. You can certainly ask your patients to tell their family and friends, but they're only going to do it if they like what you do and who you are as a person. And so, number one, be a good person. Number two, be a fantastic practitioner. Number three, care enough to explain, to invest in the patient, to really show that their outcomes are important to you. I think that's the overarching principle that we're trying to get across.
Yeah, agree.
Nice. Very good. All right, thanks everyone for tuning in. We are very close to episode 100, Bo, which will be our next one released hopefully next week. So stay tuned for episode 100. That'll be a special one. It's been a long time coming. Hopefully everyone who's been tuning into the podcast along the way has been enjoying the journey with us. We enjoyed doing it. Thanks for listening, guys. See you next time.
Cheers.